Hello everyone, this is Teacher May. Welcome to my YouTube channel, the Filipino Teacher Vlogs CFTV. Right now, just arrived from Tagbiran City Central Elementary School, where is the my first dose vaccine is being held. My Coronavac Sinovac vaccine, my first dose. So I have here my card, COVID-19 vaccination card. So my first dose is today, August, what's, yeah, August 16 to 2021. Then my second dose will be on September 13, 2021. I have here with me, kini siya, muna akong nadala from my first dose. So this is the evidence that I have already vaccinated. Mura siyag ni start siya bugat-bugat kamay kay nga ni siro ang feeling good nga ma-injectionan. Long gone those days dugay na jud ko na injectionan. Bisan mga previous flu vaccine or bakuna wala ko nakasulay adto, but thanks God I have this my first dose in uh, vaccination, my Sinovac res bakuna kasangga ng bida. So, allow me to share with you some important points for Coronavac or Sinovac. Shout out to my viewers. Actually, wala na akong share ni sa Facebook Live because I am intentionally recording this for the sake of my MOVs for my first dose, Sinovac. So, pabakuna na mo guys for laban COVID-19. So, mas we have to put trust in God above all. Kay siya naman yun nasayad sa itong life. And considering the the science, no? And we all know that health is wealth. So how is the COVID-19 vaccine Coronavac or Sinovac given? The vaccine or the Sinovac will be given to you or to me as an injection into the muscle in the upper arm. So, sa akong part, gipili nila og asa ang kanang dili siya kanang gamito nimo sa more on use sa right hand nako kay mo man ni siya akong kasagaran gamiton yun pag alsa, pag sulat. So in my left arm mo ni akong gi-prefer nga gipili nga ma-injectionan so for my first dose Sinovac vaccine. The vaccine will be given into 2 doses given 4 weeks apart. And if you receive 1 dose of the COVID-19 vaccine, Coronavac, you should receive a second dose of this same vaccine 4 weeks later to complete the vaccination series. So therefore, since it's my first dose of Sinovac, so I will be receiving my second dose this coming September 13, 2021. Mega shout out to my avid fan. Hi, Vietnamese home cooking. Thank you so much. Thank you, Vietnamese home cooking. Shout out. Sir, sir or ma'am, I have my Facebook, Hazel May Duetes Ilizan. See you around. So, what is the COVID-19 vaccine Coronavac or Sinovac? Allow me to share with this. So, ako na po siyang gibasa guys for this information para reliable ang atong sources. So, allow me to read and share with you a bit of this information, salient points. What is the COVID-19 vaccine Coronavac Sinovac? The COVID-19 vaccine Coronavac or Sinovac is an investigational drug that is currently being studied in clinical trials. It has been authorized for use in people aged 18 years old and above to prevent COVID-19. So ganina, pagsud na ko sa vaccination area sa school, thank you Tagbiran City Central Elementary School for accommodating us teachers. So pagsud na ko dito, naay mga station 1, 2, and 3. So ang first station, naglinya ang mga people dito, ang mga teachers, take turns kay observing the health protocols, the minimum standard of health protocols. And then, form nga fill upan. And then, at the same time, tagaan ka ani nga card. Kaning COVID-19 vaccination card. Kini siya. This is it na. Give upan ako. What are the informations? Like, surname, ang first name, ang middle name, giba complete ang middle name, then address, then contact number, date of birth, then field health. Since I did not bring any of my number of field health, so pwede na din siya later, especially in the time of second dose, according to the designated person there in charge. Then category is A4. So I guess A4 like teachers siguro nga category because all of us kanina are teachers schedule. So 9 dosage sequence. First dose, date, the month, date, year, vaccination manufacturer, date is 8/16/2021, then vaccine manufacturer, Sinovac, then lot number, siya, then vaccinator name, ang nurse, preferably. And then, of course, naay signature, dayon, naay contact number sa ilang health facility. So, I have received this COVID-19 vaccination card, and then, they give lang the City of Tagbilaran official seal, AEFI team, Tagbilaran CHO, dayon na sila during office hours 8 a.m. to 4 p.m. Globe 0945-2394660 or Smart 0960-505-7544. And then allow me to continue sharing. Ingana kita akong beauty. Paibog sa vaccine. Marada ba ni action siya bugat-bugat na guys. So I hope everything will be fine. Second point, what is the emergency use authorization or the EUA? An EUA or emergency use authorization can be used for vaccines that are still being studied and investigated. The purpose is to provide immediate access to the vaccines in a public health emergency. An EUA may be issued if it has been determined to be safe and effective in preventing COVID-19 and there are no adequate approved or available alternatives. The EUA is not a marketing authorization which will allow the vaccines to be sold for general use. A marketing authorization requires the vaccines to have completed phase 4 clinical trials and 3 years of monitored release. And that is for the emergency use authorization. And let's go to the third salient point. Who should get COVID-19 vaccine or Coronavac or the Sinovac? This vaccine has been authorized to be used in individuals 18 years of age and older. FDA Philippines initially used an EUA for the use of the COVID-19 vaccine Coronavac in clinically healthy people aged in 18 to 59 years of age, with the recommendation that it not be used in healthcare workers with exposure to COVID-19 patients. But upon review of the scientific evidence and given the absence of other vaccines and the current risk for COVID-19, then allowed the vaccines to be used on healthcare workers and senior citizens for their protection. So mo to ganina, first station, Nagkuha kog form, then gitagaan kog card, nag-fill up ko, and of course, with the use of your own ball pen. So, sa dili pa ta magva-vaccine, guys, see to it that you have to bring your own ball pen. Kaya what mo hatag ball pen nimo dito, following the health protocols. So, thank you kay nakadapog kog ball pen. First, nag-all ko kay abi na ko red ball pen akong nada, but fortunately, I had my black ball pen. So, I fill out everything from surname, first name, middle name, suffix, address, contact number, date of birth, PhilHealth, and a category. And then after which, first station to siya. So baka second station, naglinya na pod mi, na mo kuwag na oximeter, kadang kuha sa oxygen, si magpabutang ng finger bitaw sa imong finger. That is oximeter. Yeah. And then, aron makuha nimong status sa imong oxygen, and after which kuan ka og kanang blood pressure og okay ra ba, and then there are certain questions and interview portions like nakaagi ba ka og kanang unsa imong gibati karon, are you feeling okay, are you feeling all right, and nyagi ba ka og nabay kay mga allergy, what are the allergy foods, kung na kay allergy, skin allergy, what kind of allergy, and food allergy, unsa nga particular foods, what are particular foods that you are allergy with. So you have to explain and tell everything as fast as you can, as much as you can. So as best and as honest as you can. So putanon ka na nakuan ba ka o kanang COVID-19 nga quarantine facilities na expose, or COVID-19 nga patient na expose pa ka, or nyagi ba na ba kay ubo, fever, mga other like na ba kay exposed pa ka sa HIV or whatever kanang health issues and concerns. So you have to tell something, tell everything. So after which, muna tayo station 2. Ready na ka for station 3. And that station 3, naigamay nga table, nga imong ihatag ni siya, and katong form, marato siya, preparation for the vaccination proper. So naay siya station 3, waiting area, mga kato ganina marag by 6. By 6 ang pag accommodate. So luckily I was there, and then I was able to have my first dose Sinovac vaccine. Medyo kulba gamay. Para patang gamay ba nga. One yagi injection. So the third salient point to be shared is that who should get COVID-19 vaccine, Coronavac, Sinovac? Muna to siya. Then the fourth salient points. Who should not get the COVID-19 vaccine, Coronavac, Sinovac? You should not get the Coronavac, Sinovac, COVID-19 vaccine if you are below 18 years old. You should also not get this vaccine if you had a severe allergic reaction after a previous dose of this vaccine, and you also should not get the COVID-19 vaccine, Coronavac, Sinovac. So shout out again to my avid fan, Vietnamese home cooking, patilaw ko sa imong dishes, sir and ma'am. Congratulations, your first dose. So, you rocked, and thank you for sharing. Stay safe and healthy. Always welcome. My pleasure. Vietnamese home cooking. Please don't forget to like, share, and subscribe to their channel, Vietnamese Home Cooking. See you around. Thank you so much for watching. I will continue. You should not get the Coronavac, Sinovac COVID-19 vaccine if you are below 18 years old. And you should also not get this vaccine if you had severe allergic reaction after a previous dose of this vaccine. Hala. So meaning to say, if below ka 18 years old, dili ka pwede sa vaccine. And then kung 18 years above po ka, under the check-up nga okay ang imong mga conditions in that day, so okay. But naay siya something i-share po nila nga. For example, if you have done for the first dose And the second time around, like in on September 13, simako ko, dili not feeling well, dili ka maayo sa imong reaction. So, pwede siya not to continue. So, nagibutang if you had severe allergic reaction after a previous dose of this vaccine, you also should not get the COVID-19 vaccine, Coronavac or Sinovac if you had experienced any major blood clotting in combination with a low blood platelet count after receiving any COVID vaccine. So, moto siya. So, we are just hoping and praying that everything will be fine. Nasiguro gamay mga reactions, but it's natural. And they said, for example, na ay mga hilanat gamay, just take Biogesic. The very best recommended generic tablet for not feeling well is Biogesic. Biogesic lang ang kalaban. What should you mention to your vaccinator provider before you get the COVID-19 vaccine or Coronavac Sinovac? Muna check mo to ganina akong share guys that tell your vaccination provider if you have number 1 had a severe allergic reaction to the first dose of the vaccine. Second, allergies to food like egg or medicine or with asthma. Then third, bleeding disorder or are currently on a blood thinner. Then fourth, fever, symptoms like colds, coughs, sore throat, and others. Other symptoms from your comorbidity, history of exposure to a confirmed suspected COVID-19 case in the past 14 days previously diagnosed or treated for COVID-19. Pregnant or plan to become pregnant, receive any vaccines in the past 2 weeks. Compromised or currently on have been in the past 6 months on a medicine that affects your immune system. Depending on the results of the health screening by your vaccination provider, your vaccination might get deferred to another date, or you might require a medical clearance from your attending physician before you'll be allowed to get the vaccine. Okay, back again. Welcome to the Filipina Teacher Vlogs TFTV. Sharing of the Coronavac, Sinovac, Bakuna kasangga ng bida. Okay, how is the COVID-19 vaccine Coronavac given? So, the vaccine will be given to you as an injection into the muzzle in the upper arm. It could be right or left, it's your choice. But they preferred katong dili siya hago. For example, katong dili mo gamiton sa pagtrabaho, pag-asa, or pag-right. So, murag okay na siyang left arm. The vaccine will be given into 2 doses given 4 weeks apart. If you receive 1 dose of the COVID-19 vaccine Coronavac, and you should receive a second dose of this same vaccine 4 weeks later to complete the vaccination series. What are the benefits of COVID-19 vaccine Coronavac Sinovac? COVID-19 vaccine Coronavac or Sinovac stimulates the body's natural defense immune system, and it causes the body to produce its own protection antibodies against the virus. This will help to protect you against COVID-19 in the future. Then 65% to 91% efficacy against COVID-19. So guys, dili siya 100% good because it's under currently being studied in clinical trials. The duration of protection against COVID-19 is currently unknown, and this is not a live virus and cannot cause a person to get COVID-19, okay? I would like to reiterate and emphasize, I would like to stress out that this is not a live virus and cannot cause a person to get COVID-19. So, mabakuna na mo guys. This is my first dose and let's all vaccinated. Kay dili man ni siya virus nga live nga gibutang diha para matakdan kag virus. Okay? What are the risks of COVID-19 vaccine Coronavac Sinovac? The reported side effects are generally mild to moderate. These are first, injection site tenderness, second, injection site, third, headache, fourth, fatigue, fifth, muscle pain, six, malaise, seven, fever, eight, chills, nine, joint pain, 10, nausea, 11, swelling of lymph nodes. There is also a rare chance that this vaccine could cause a severe allergic reaction. And if you experience symptoms such as tightening or of the throat or difficulty of breathing, immediately seek consultation with the nearest hospital. Si Makulang Town, Lord. Ilang Town. This may not be all the possible side effects of the vaccine. Serious unexpected side effects may occur. And the COVID-19 vaccine Coronavac is still being studied in clinical trials. Seek consultation with your physician or nearest health facility and call this number nga gihatag, especially for Tagbilan City. So if you are in Tagbilan City, call number 0945-239-4660 for Globe. And for Smart, 0960-505-7554 for Smart. Okay? Home cooking. Thank you so much for watching. Ganahan kay ko sir sa imong comment. Congratulations to your first dose. You rocked and thank you for sharing. Yes, thank you so much. It's my pleasure and honor to share with you because this is my first dose of Sinovac. And I hope that everyone is experiencing good feelings, the reactions of this vaccine. And I hope everybody will be vaccinated. Tara na, bakuna na, vaccine, go, go, go. Magbugat na guys. Thank you so much. See you around. Thank you for listening and watching. And please don't forget to like, share, and subscribe to my YouTube channel, The Filipina Teacher Vlogs TF TV. See you around. God bless everyone. Thank you. Thank you. Bye bye. I love you.